I'm Dr. Kimberly Manning.
And this is Dr. Ashley McMullen. And you're listening to the Human Doctor Podcast, where we explore the human side of medicine, along with teaching, living, learning, and all things in between. Using the power of storytelling, conversation, and connectedness.
Hey, we're two dope academic internal medicine doctors, but we ain't your doctors. So if you perceive anything we say here as medical advice, no, it ain't that. Also, the things we say, they only reflect our brilliant Black woman magic mind and not our employers.
You could have been anywhere, y'all, but you chose to be here with us, and we appreciate you. Let's go.
Happy Monday, Fun Day.
Happy Fun Day Monday. Turns out for some people, this is actually a holiday, but
I think my job was like, are you the president? If you ain't the president, then you need to be.
Exactly.
Yeah, because I was very much in the clinic at Grady Memorial Hospital serving our amazing patients. And
yeah,
not one time did anybody ask me, I'm surprised you're here today. Nope. It was like, look at this rash and what you think about this.
Well, we appreciate your service to the community. I at least get to work from home on Mondays. So
okay.
I still got to put in the time, but I'm always grateful to be at home, especially when, the few days out the year when the weather in California isn't perfect. So
I love how you be trying to make it sound like Northern California got perfect weather. It does not, y'all. Don't let her gaslight you.
Oh, man.
So what's new?
I actually just got back from Houston yesterday. I was celebrating my mother's birthday.
Let's go.
Yeah.
Okay. What did y'all do?
Took her to dinner with the family. I spent, a good portion of the day with my 6-year-old nephew, and we made a handwritten card for her, complete with his own spelling and penmanship. So that
Killing
was
the auntie game.
I really was.
You know what's really cool? Guess what I did this weekend?
What's that?
Went out to dinner to celebrate my mother's birthday. I'm not joking. Except I didn't leave town. I was here in Atlanta because my mom was here. But yeah, that's what we did.
What day is your mother's birthday?
My mother's birthday is the 16th.
Oh.
What about your mama?
On the 17th.
You know what? That's why we're so awesome and we're so bonded.
Exactly.
Yeah, we have really awesome moms. I was telling her that I was trying to think about any point where it was difficult to be her daughter.
Ooh.
And I cannot think of one time where it was difficult to be my mother's daughter. It's funny because I'm a daddy's girl, and my father, had very, very high expectations of us. He was the disciplinarian. It was not always easy to be my father's child. We have a lot, we butt heads on things. My father had strong opinions about things. We would argue about things. And I would always tell him I'm the monster you created. You created me to think for myself. I don't agree with you, sir. But my mother is, and she's not a pushover. She's just this really kind, fun, easygoing, creative soul that it's like everybody can agree upon loving her. Like everybody can agree upon that. There's no sort of, oh, I don't know about her. All the grandkids love her. The kids all love her. And I think I really underestimated how dope my mom was until later. Everything creative in me is from my mother. Everything assertive in me probably is from my father, but my mother is a creative, real creative spirit. So shout out to my mama.
Yeah. Shout out to your mom. Shout out to my mom. I feel very similarly. I always felt like my mom and I were very different. I always felt like I should be more like my mom because everybody loves my mom. She's so kind. She's beautiful. Everybody is obsessed with her. And I'm just like, wow, I should be kinder. I should try to look more like my mom. But as I've gotten older, I find that we are more alike than I even had imagined, this deep well of empathy and compassion and just this kind of, I won't say I'm quite as selfless as my mom. I don't know about all that, but
So,
Um,
people were joking me about the fact that I have never been to Boston. I brought that up
yep.
last week.
Hmm.
Seeing as we getting ready to go to the Society of General Internal Medicine national meeting,
Hmm.
where we gonna be presenting
Yep.
and we gonna be recording.
Yep.
And you know what? We just might have subject verb disagreement, just like I just had. Because guess what? We can. It's our podcast, and we can
Yes.
subject verb disagree if we want to, and shall. What
Mhm.
should I do in Boston? You've been there before. Like I said, y'all might have missed this last week, but I said that some people had such good medical school performances that they were being recruited
Ah,
by the Harvard programs. You don't
okay.
edit this out. I was not being recruited by the Harvard residency programs. Ashley was. So she has been to Boston. Me, I had no reason to go to Boston.
Okay. I'm glad that you took 2 episodes to flesh out.
Because I felt like it wasn't made clear last week. I was like, do you think I just threw shade at her? No, 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 no. I threw shade at me.
I cannot wait to unpack that with you in a future episode. But, I was lucky and privileged to have the experience where I felt like I was able to have a say in which residency program I wanted to go to. And
Fantastic.
that was a journey, but I made it. I made that shit. So,
Okay, I know. And you know what? You worked for it. Mhm.
mhm.
You sure did. You did. Now, I worked for it, but I peaked a little late. So by the time I had peaked, it was like, oh, honey, but wait a minute. You should have been doing a little bit more in that first year of medical school, when you,
Yeah.
fell in love with that boy and you wasn't going to class. But I made a comeback. So y'all look at me now. I'm a whole professor. Y'all, this is really the point of this is that we're going to be at the SGIM meeting. We are nerdy, enthusiastic general internists, and we just hope any aspiring general internist adjacent folk come. You should register for that meeting. That meeting is about to be lit. It,
Hmm.
it really is. So we hope to see you. And for those who are registering, please come check out your girls. Okay, kings, queens, and non-binary royalty. Y'all, today is your lucky day. Here in Atlanta, it is now dark outside because I had to work today on President's Day, but Ashley accommodated me and will accommodate you shortly with what you have really all been waiting for. You had a bye week last week with me, and now it is here what you want. And that is Ashley McMullen telling you a story from the archives. My sis, what is the what today?
I'm gonna be completely honest with you. Like I've got the story in mind, but I completely forgot about the what.
Oh, you forgot about the
I forgot
what?
about the what, but I
But
think something can work. The what is birth.
birth.
Hmm.
Oh, Lord.
You didn't
Okay.
see that coming, did you?
I did not even see that coming,
Neither
but
did I, because I just came up with it.
you was right now years old when you heard of it,
Yeah, I know. It's
huh?
like, and
Okay.
yeah.
Talk to me. I'm listening. I'm
Okay.
cozy and ready.
Hmm. Yeah. So I'm glad that we got to share a little bit about our mothers because, this is a story that really is my mom's, but also mine. So I will be taking you back to 1987,
Please
perhaps.
tell me that's not when you were born.
Okay,
Please.
I won't
Is
tell
that
you.
when you were born? My God,
Yes.
I'm so old. Okay. No, no, but this is not my story.
Yeah.
Ooh, back to you.
Yes.
87. Yes.
1987, fall of 1987.
Okay.
So my mom is a couple years into her career as a nurse. She's in her late 20s. And at that time, my mom had taken a job in a hospital in the Houston Medical Center. So kind of a well-staffed, busy hospital there.
Mhm.
And she was working as a floor nurse at the time. So,
Mhm.
nurses on the floors are assigned, several patients each shift, and that can range from manageable to barely manageable.
Sure.
And so, she was doing these types of shifts most days, along with caring for my older brother at that time, who was probably about 3, I think. My dad was not able to be a reliable partner in this situation. And so my mom was largely doing all this work on her own. My mom was born to be a nurse. Like she is an incredible nurse. She is great at her job. She loves children. She was meant to be a pediatric nurse, and she's excellent at that. But in the course of her pregnancy, after having, not missed a day, not really called in sick, always showed up to do the job, she was having some difficulties, and many of which stem from just the environment that she was in.
Mm.
So she was usually working a shift from like 7 to 3, 7 a.m. to 3 p.m. She's on her feet the entire time. And I think that's something, I will say as a physician, that's not well appreciated because we spend a lot of our time
Sitting down.
exactly, and everybody kind of works around our time. We go in and see the patient when we want to, and then we leave and we sit down and we'll respond to messages when we want to. So, but as a nurse, you're constantly, on the move, getting medications, like responding to call buttons, doing your own rounds. And so at that time in the 80s, she was also having to do a lot of kind of like labor intensive work as well. So she had one experience probably around her second trimester where she was having to lift a patient and ended up getting injured. So she had to be out for some time after that injury. And then there was another time subsequently. So, another responsibility for her at that time was to manage like the food trays.
Hmm.
And so, when the carts would come, you'd have to like get the trays off of it and bring them to the room. And so, there's trays like at the very bottom that, she had to kind of bend over
All the
and
way over.
bend all the way over and get the trays. And, she said as she was coming up, she felt another like excruciating pain, like in her side and in her
Mm.
back. And at that point, she was a little later in the pregnancy and she had to do about a week or so of bed rest.
Mm.
And as a result of that, her supervisor, the managing nurse, actually wrote her up for having to miss work.
Mm. Mm. Mm.
Yeah.
Mm. Mm. Mm.
So, in this environment, not feeling particularly empowered to ask for what you need, now she's entering her third trimester.
Mhm.
And towards the end of the pregnancy, there's, this expectation that you come in to see your OB every week.
Mhm.
But the OB appointments only run until 3 p.m.
Of course.
and she gets off at 3 p.m.
Mm.
And she does not have much power in that situation to ask for, time off every week to go
Mm.
see her OB. And so she ended up having to miss a lot of those appointments.
Mm.
At the same time, she's also kind of dealt with chronic hypertension, for a lot of her life. And of course, now we're kind of in a stressful environment, not only from work, but also having to manage things at home and not having a lot of help.
And a 3-year-old, Lord.
Exactly. But that's not really being checked on a regular basis. And so one day she's, working another shift and she's got this really intense feeling of just being unwell, like this extreme nausea, headache. And so she goes to her supervisor. The supervisor, well, let me check your blood pressure real quick. Let's just see what it looks like. Blood pressure was sky high.
Oh
And
man,
the supervisor suggested that she go in the break room and just rest her head for a moment and then come back to work.
that is crazy. Yeah, go sleep off that preeclampsia, girl.
Exactly. Go sleep it off. Now we're, back at work again. And she has another episode. And this time, she's having excruciating pain.
Mm.
And so at this point, she calls her OB. And the OB was just like, you need to come to the hospital right now. It wasn't a far distance to get to the hospital where she was supposed to deliver.
Mm.
But my mom made a choice to go home first. She couldn't rely on my dad to like bring her clothes. She wanted to grab her clothes. She'd also been on her feet for 8 hours. And so she wanted to kind of clean up a little bit before going to the hospital. Evangelist Shelley was on her way at that point
Mhm.
from Chicago, but wasn't going to be able to get there. So my mom had to go by herself.
Mm.
She gets to the hospital and the OB is furious at her,
Mm.
like expressing anger and coldness because she didn't come straight to the hospital.
Mm.
So they get her set up, put the ultrasound probe on, and the baby, me, is not moving.
Oh my God.
We don't know if this baby's going to make it. We need to start inducing labor now. My mom is at some point in the room by herself. She's laying there and she can hear the nurses. And I don't know if the OB was involved in this conversation too, but definitely the nurses right outside her room. And they're disparaging her.
Oh my God.
Yes.
Like,
Making
what was she doing? What was she thinking? I guess.
exactly. And not only did she, commenting on the fact that she didn't come to the hospital, but that she had missed a lot of her prenatal appointments,
Mm,
over the last month. It's just fascinating. Here you have another nurse in a dire situation, like potentially about to lose her child.
mm,
And basically the inclination is that this is her fault.
mm,
And that is the energy that the medical staff is bringing into this space.
mm.
This is again, it's the 80s. You're not getting on Facebook Live to document the thing like,
Right,
oh,
right.
Black Lives Matter.
Yeah,
It's like you're swimming in the water of this type
yeah.
of
Bias, lack of
yeah.
humanism, but there was no language for any of that.
And so you don't even quite realize, I'm watching her tell me this story, and it's almost like she's just now realizing how messed up this was.
Yep, yep.
But at the time, there's no power there. And she told me she didn't cry, she didn't get upset. She just kind of felt resigned, in her mind. She was just like, man, I'm doing the best that I can.
Mm,
So, whatever happens, happens.
mm,
She gets the epidural and proceeds to go into labor. And, spoiler alert, I live and
hmm.
I'm fine. But my mom had to go straight to the ICU afterwards,
Wow.
to be treated for preeclampsia. Um,
Eclampsia. You know,
Eclampsia. Sorry, it's
eclampsia, though.
been a
It ain't
minute.
pre no more. Yeah. Okay. Oh my
Yeah.
God.
And so she's in the ICU. They're treating her with magnesium IV,
Mm,
like mini IV electrolytes. It is a very painful infusion.
mm-hmm.
When my mom was telling me this story, she's like, I can feel it like it was yesterday.
Mm,
Um, the burning and the pain in her arm, and it seemed like the IV had like infiltrated. She could actually see her skin changing color.
mm.
And so she asked, please come take this IV out. And nobody came.
Oh my God.
She's on bed rest, she can't move.
They're like, that's what you get.
Yeah, and that's what it was.
Mm,
So she managed to get her OB on the phone and told her OB, who was not even in the hospital, what she's like, I have this IV in my arm and it's burning. Like, I need someone to take it out, or I'm going to have to take it out. So
mm,
the OB called the hospital. And then once the OB called, then someone came. My mom told me it actually wasn't until that evening there was a night nurse who she also didn't have racial concordance with, but that was the first person who actually talked to her like a human being,
mm,
who actually was comforting and really supportive until my grandmother could get there.
mm.
So there's a couple ironies about this story as well. The first I'll share is that that same supervisor who told her to go lay down in the call room when she was having preeclampsia, when my mom later recovered and went back to work, the same supervisor had subsequently gotten pregnant. Uh,
Mm,
and that supervisor at some point was at work and not feeling well,
mm,
and had actually asked my mom to check her blood pressure.
mm,
So my mom did, and her blood pressure was high, but it wasn't nearly as high as my
mm.
mom's was. And you can imagine what that supervisor did
Oh
afterward.
yeah. Oh, clearly.
Went home.
Oh yeah. Went
Mhm,
home.
mhm.
Because Obvi. Did
Came
she
back.
write herself up?
Yeah, exactly. So,
Uh,
that's the first irony. The second irony is that this same hospital where my mom had this kind of harrowing experience birthing me was the same hospital I would later train in as a medical student.
wow.
Mhm. And then the other piece, which is less of an irony because, this perfectly makes sense for who my mom is. But my mom now is in like a supervising role.
Mm-hmm.
And she has sensitivity to when the nurses that she supervises are pregnant. And
Mm,
there's one in particular who usually would take the bus or something to work. And my mom would go pick her up every day of her
wow.
last trimester and bring her to
Wow.
work.
Mm, I mean, you know what? I'm sitting here trying to think about what to even say back to this, but I almost feels like the story, the thing speaks for itself.
Mhm.
There's a part of me that says, well, I'm glad that there's some places where we know not to behave in that way, right? To tell some lady with sky high blood pressure to go lay down, I think about experiences that I'm sure we've had when we were in training and stuff where like, oh, yeah, I probably should have gone home. But that's a lot different than when you are actually carrying a, just an innocent life inside of you. Um, that's horrifying.
Mhm.
Um, I think we've mentioned this before, but I can't remember if it was we were recording when we mentioned it. But I also think that more than just the system buys into this idea of, who we are as Black women. We buy into it,
Mhm.
right? Because your mother was in a life-threatening situation. It was a medical emergency what she was dealing with. But your mother decided that, like, okay, but you know, I'm gonna go see about these kids and I'm gonna go ahead and rinse off real quick and put
Mhm.
on me some clean underwear and some clean socks and get my stuff together and I'll be okay. Much like when I told you about the time when I had my baby and right after I had a baby, I didn't like what they brought me on a tray. And I put my pants on and went outside to the elevator and told the nurse to her face, my people used to squat out in the fields, have a baby, and go back to picking cotton. You think I can't go down to the cafeteria? Come on, man.
Mhm.
But that was because I bought into this whole idea about us as like superhuman and able to
Yeah.
kind of shake it off.
Mm.
And that is not actually to blame your mother. It's more to blame a system that made this a mechanism of survival for us.
Absolutely.
Right. So like as much as I love the thought of me being a fist in the air, strong Black woman, I'm also okay with being a vulnerable Black woman and somebody who, yeah, you know what, you can let me lay down and you can rub my feet with, essential oils. And you know what, you can give me some days off.
Mhm.
And you know what, I probably should not be in clinic if I have a temperature of 103. I probably shouldn't. And you know what, I won't.
Mhm.
Like I won't.
Mhm.
So yeah, it's a lot in that time in particular, and still now that lends toward those things happening to us. And I think one piece of it is we have to realize that it's okay for us to be vulnerable. It's okay for us to like need some help, and it's okay for us to lean into advocating for ourselves.
Mhm.
But if you got small kids at home and you have a partner who isn't equipped to help you out, a 3-year-old, like, look, man, if you got a 3-year-old, you're gonna see about your 3-year-old. I would have done the exact same thing. I would have. I mean, you know what I mean? I would have done
Yeah.
that too.
Yeah.
It's crazy.
Yeah. You're right. There's so many layers to this.
Mm-hmm.
And particularly like, what my mom was expressing to me was just like this sense of powerlessness.
Mm.
And it started from before the emergency. It started from being in an environment where you don't feel empowered,
Yep.
where you
You can't see about yourself.
exactly like, people are already looking at you with a target on your back that, you asking for what you need is a sign of you being, defiant or angry or unprofessional.
Yeah, and you're not asking to go get a manicure. You're actually asking to see about your body, which is doing something that everybody knows can be life-threatening, which is have a human life in it.
Mhm.
I mean, that's very different than you just asking, for a minute. Um, and I'm not saying people shouldn't get a minute, but I'm just saying that, again, this idea of us being superhuman, um, it is so pervasive. It is like they think it, but we think it.
Mhm.
And sometimes it's cool for us to think it because it like works out, right? Like, hey, yeah, that's right. That's what we did, and we made that happen. And I can't believe that she was able to do that. Of course she could, because
Mhm.
that's what sisters do, you
Mhm.
know, until you just realize how crazy that is.
Yeah, absolutely. It's interesting because, it covers so many classes and professions. I mean, obviously, like, for many Black women, particularly those who work in kind of service related jobs, who work in like
Yeah.
hours-based jobs, where it's just like you're not in a place of power to do anything that would risk, getting your hours cut or, losing your insurance. And for folks who work in these kind of professional sectors, I'm thinking about female physicians who work in kind of smaller like
Yep.
practices,
Yep.
particularly in maybe a surgical specialty where you're like one of few or maybe the only woman there.
Yeah.
And like what it would mean to ask for, a day off a week.
Because when somebody's off, somebody's on,
Hmm.
But your mother was making a very, very unselfish choice.
Hmm.
Her choice was to protect her family and to keep the lights on and to make sure that she had benefits and that, she could see about these children with resources. And if you got to choose between going to a doctor's visit or doing whatever you got to do to feed your family, people will do what they have to do.
Hmm. Yeah,
Man, I'm sorry your mom went through that. That must
me
have been a
too.
hard story to tell you.
It was hard. And hard to hear because, it's one thing when you hear all the statistics and horror stories, it's another when like it's your mom,
Yeah.
suffering to bring you into the world. But I'm grateful that she told me and she was, happy for me to share it because, this stuff is still happening.
Well, let me tell you something. If I was your mama, I would have gotten your graduation picture, put on a giant medallion, and put it around my neck and walked up on that ward like, what? My daughter, a doctor, what?
Yeah. Yeah. I did look up the doctor on my birth certificate.
I know that's right, girl.
Yeah.
Well, listen, shout out to your brave, selfless mother, for all the children that she was taking care of, and for the children at home that she made those hard decisions for. I know that was not easy. And shout out to, every Black woman and every Black birthing person out there, who has the opportunity to bring a life into the world and who may feel a little bit nervous or vulnerable, lean into what you deserve, who you are. Shout out to the people who are allies, and who do care and pay attention. Shout out to that nurse that humanized your mom,
Mhm.
um, because the people that, treat you well, they don't have to look like you. They
Mhm.
don't. They just need to meet you on a human level and but realize some of the forces at play that can impact, the kind of care that people get and the kind of care people are willing to ask for.
Mhm.
So, you know
Amen.
what? We got to do better.
Yes, we can. And we will.
Yes.
I'm hopeful.
Well, little baby Ashley, born in 1987, the year that I was visiting Tuskegee University to go to college. I'm really glad that, you lived to tell.
Yes, me too. Me
Yeah.
too.
Yeah.
Mm.
I love you, sis.
Love you too. That wraps up this week's episode of the Human Doctor Podcast.
Special thanks to our favorite brother gastroenterologist, Dr. Chuma Obiname, for the beats. Shout out to the Dr. Ashley McMullen for editing and production.
Mad love to our podcast family at The Nocturnist and the Clinical Problem Solvers, our Med Twitter fam.
And especially shout out to all of you, our listeners.
Until next week, remember,
we see you and you are enough. Holla!